Today, I want to talk about vaginal exams. Do I have to have one? Why do they do them? Does it hurt? Vaginal exams may also be referred to as a pelvic exam or a cervical check or just a check. Do you want me to check you? A lot of times that's what they ask. When this is done, your care provider, your midwife, or maybe a nurse is going to insert a glove. They're going to use lubricant on their fingers and they're going to insert it into the vagina. And they do that to assess the cervix and possibly the baby's position. So they're looking at 5 different things when they do a vaginal exam. The first is dilation. This is the most popular one. The most common thing that we hear is, how dilated am I? So the dilation refers to how open the cervix is. During your pregnancy, your cervix is closed tight. It is there to protect the baby. As your body prepares to labor, it might start dilating. It might not. This is measured in centimeters, and the goal during labor is to get to 10 centimeters before birth and before you begin pushing. So that is dilation. Now with effacement is how thick or thin your cervix is. This is measured in a percentage. So if you are 0% effaced, your cervix is thick. If you are 100% effaced, that means that your cervix is completely thinned down. It's really, really thin. And so they might do a vaginal exam and say, oh, you're about 50% effaced. The next thing they're looking for is the baby station. So how high or low the baby's head is in relation to the ischial spines on the pelvis. And so if their head is high, they are in a negative station. If they are lined up right with those spines on the pelvis, that is a 0 station. And if it is below that, that is a plus station. And that's really good when baby gets down into a plus station, because that means baby is dropping down into the pelvis. The next thing that they are looking for might be just the position of the baby in general, as far as like what direction they are facing. And so sometimes they can tell, depending on the sutures on the baby's head, whether they're facing your back or whether maybe they're in a posterior position. And so that can be helpful to know sometimes, just to know what direction the baby is facing. They are also looking for the position of the cervix. Now, during pregnancy, your cervix is in a more posterior position, but as labor approaches, it's going to move into more of an anterior position. They are also they call it the ripeness of the cervix. So how firm or soft the cervix is. During pregnancy, your cervix is going to be hard, and then it softens as labor approaches. And so they call that the ripeness. So think of a banana. So if you have a really green banana that is not ready to be peeled yet, it's hard to peel. Your cervix is kind of that way. It's going to be thick and it's going to be hard to open. And so same thing when your cervix is really thick, so it's not effaced, it's really hard, it's going to be harder for it to open. Whereas when you have a really ripe banana that's got lots of brown spots on it, that peel is it's getting thinner and it's much easier to open. Your cervix is kind of the same way. Your provider might offer to do a cervical exam or a vaginal exam during pregnancy. Some providers start doing this as early as 34, 36 weeks. These early exams can sometimes cause a roller coaster of emotions. If they do a vaginal exam and say maybe you're 2 centimeters, well, that's great. Your body's doing something. It can be really easy to get excited thinking, great, labor's right around the corner. And then you're anxious for, the next few weeks. And then maybe you're disappointed when labor doesn't happen. So you might not be dilated at all. And that can cause some anxiety and some worry as well. And so before labor, you might dilate, your cervix might start to efface a little bit and get softer, or you might not. And both of those are totally normal. Having a vaginal exam during pregnancy before you go into labor is not going to tell you when you're going to go into labor or have your baby. There is a famous saying out there that you hear a lot in the birth community, and that is that your cervix is not a crystal ball. It's not going to tell us when you're going to go into labor, unfortunately. So there are some risks associated with vaginal exams. You might experience some discomfort and pain. especially if you aren't dilated at all or your cervix is still hard and pretty posterior, they can be more uncomfortable. The chance of infection increases, and there is a chance that they might actually accidentally break your water. And then once your water is broken, then that chance of infection increases every time they do a vaginal exam. Some people are also concerned that their provider is going to strip their membranes without their permission. They're not going to even ask or say anything to try to kind of get them into labor, push them into labor. That's kind of a whole other conversation, but I have heard plenty of stories of that happening, and lots of people will kind of tell you about that. Some people also just find this procedure kind of invasive and unnecessary. So if your provider is telling you that they would like to do a vaginal exam, ask them why. Why do they think it's necessary? What information are they wanting to get from it? Is it going to affect other decisions that you make, or is it going to affect anything else? And if you don't want one, you can say no. Now, in labor, you will likely be offered a cervical exam or a vaginal exam when you arrive at your birthplace. That is very common. And they also usually offer at least one before you start pushing as well. Again, if you choose to do this, or you can decline it as if you want, you are also more likely to have more vaginal exams if you do have an epidural, because when you're numb from the waist down, it's kind of hard to tell how dilated you are in other ways that we can usually see and take a good guess about how dilated you are. So you're more likely to have them done. So vaginal exams, they can give us helpful information. It just depends on really what the situation looks like, what you're experiencing. This is a good thing to kind of weigh the benefits and risks. Again, talk to your provider before you consent to one. Make sure you feel comfortable with the decision to either get one or to not get one. Again, don't be afraid to ask questions. I think a lot of times, I call it like the emotional risk of getting a vaginal exam. It's that worry, the concern, it's maybe the disappointment if you're not as dilated as you hoped you would be. Or maybe sometimes it can be a good thing. Sometimes it's good to get that information. So definitely talk to your provider a lot, weigh the pros and cons, and until you feel comfortable with either getting one or not getting one and making that decision. So I hope this was helpful. Be sure to like and subscribe and follow along for more information to help you prepare for your amazing birth.